I'm extremely sorry. There was a power cut right exactly around 9:55, and I was unable to take the class, and it's already half an hour late. I'm so extremely sorry for this, but this time it was not my fault. We'll just quickly cover the Clostridium, just the important points about the Clostridium. Okay, so welcome back to Unacademy. Let's get NEET PG. Myself, Dr. Muskan Chaudhary, and we will be covering an important topic and the important images from the topic of the Clostridium. So, Unacademy is the India's largest learning platform where you can access both the live and the recorded sessions, beneficial for the students who are at periphery and can watch the recorded sessions whenever and wherever. Compete in the live TNDs and can get the printed and the digital notes, study on the device anywhere. Now, around 25,000 MCQs are being provided by the Unacademy. So, it is a clinical and integrated essentials. And even the preparator is very famous for its video lectures and rapid revision note sessions for the students, because to get concise 19 subjects course for the single examination is a huge deal. And Unacademy with the prep letter provides that. All right. Now, please do use my code, that is Muskan10, to get 10% of the discount. And raise a hand technique feature something new, that is an academy where students can get into one-on-one interaction with the educators, and they can solve the queries and do the can interact within the live vivas and the live sessions with the educators. Almost every month, one examination being held by the Unacademy, and that is on the next test will be on 23rd of the October from 2 to 4 p.m. and around 120 MCQs will be asked. All right, so please do not miss these examinations, because these are important, and which help you analyze the random questions, help you analyze to get assess into the preparation, so that we can evaluate that where do we stand. 25,000 MCQs based on the all the latest examination pattern, and including the detailed examination, interactive classes with the polling, raise a hand feature, and do not miss any class, because we get the notification from favorite educators whom you follow, and the lecture notes, that is anytime and anywhere. Till 21st of October, if you subscribe to 24 months, you must have gotten 4 months subscription totally free, and with 12 months, 2 months subscription totally free. All right, so now we'll study about the Clostridium. Some important points. I'll just write down some important points about the Clostridium. Now, the first thing is that they are what gram positive. They are what gram positive bacillus. Although the complete PDF is available in this lecture, but I'll just, since we need to cover the topic within half an hour, only the important highlighted points from where the question has been repeatedly been asked will be covered. All right, so they are gram positive bacillus, and they show what stately motility. Okay, why? Because they are what peritrichous. They are peritrichous in nature, peritrichous flagella. But since it also has exceptions, they having what the peritrichous flagella, and they are what motile. But what are the exceptions of the non-motile Clostridium? Non-motile Clostridium. What is the exception of non-motile Clostridium? One is the Clostridium perfringens. One is the Clostridium perfringens, and the other is the Clostridium tetani, that is type 6. All right, so what is the important point to remember, that they are, although they are motile with the peritrichous flagella, but Clostridium tetani type 6 and Clostridium perfringens are what non-motile. The other important point that we need to remember, that they are non-capsulated. But again Clostridium perfringens are what capsulated. It also again forms exception here. Okay, it is what capsulated. The other important point is that they are non-motile, but Clostridium perfringens and tetani are motile. They are motile, but Clostridium perfringens and tetanus are non-motile. They are non-capsulated, but Clostridium perfringens capsulated. They are spore forming bacteria. We already discussed we already discussed that two type of bacteria, that one is bacillus and another is the clostridium, are the spore forming. And the clostridium is what having the bulging spores, bulging spores. Okay, bulging spores, and the spores are killed at 100 degrees Celsius. The spores are killed at 100 degrees Celsius, but again here, but the spores of the Clostridium botulinum and the Clostridium perfringens, they are what heat resistant, they are what heat resistant, and they are not killed at around 100 degrees Celsius. So they are what, they are heat resistance and not killed around 100 degrees Celsius. Now what is another point? The position of the spores, the position of spores. Okay. Now when we talk about the position of the spores, that we need to remember, although most of them are having what, subterminal spores. Okay, they are having what, subterminal spores, like Clostridium perfringens, other than the BHMS, that is, cut down the M to BHNS, that is what, that was a Clostridium botulism, Clostridium this histolyticum, Clostridium novi, and Clostridium septicum. ठीक है. So position of the spores, that we need to remember that most of the spores are subterminal, and the BHMS have the subterminal spores, that is the Clostridium B for botulinum, histolyticum novi, and the septicum. ठीक है. So position of the spores is important to remember. What is the most important to remember? The terminal spore, spore is terminal, along that it is what, oval, oval terminal spore, oval terminal spore, and terminal spore, and it is what, circular or spherical in shape, circular or spherical. If it is like this, circular, or it is either like oval shape. Okay. If it is terminal spore and oval shape, then it is what, similar to that of the tennis racket, tennis racket appearance, that is what present in the Clostridium, Clostridium tertium, and Clostridium difficile. ठीक है. If it is circular and terminal, that is similar to what, drumstick appearance, drumstick appearance, and it is present in the Clostridium tetani. ठीक है, Clostridium tetani. All right. If the spore is terminal and the oval, that is what, it is similar to that of tennis racket. It is present where, tennis racket is present where, in the Clostridium difficile and the Clostridium tertium. If it is terminal and circular, that it is what, drumstick appearance, drumstick appearance, and it is present in the Clostridium tetani, Clostridium tetani. The other important point that we need to remember, the other important point, the other important point is that about the culture. ठीक है. Culture, they are what, they are obligate, obligate and arrow, that is A B C is obligate and arrow, that is A B and C. A is for actinomyces, ठीक है, B for bacteroids, and C for Clostridium. All these are what, obligate and arrow. We need to remember the examples of the obligate and arrow, that is A, B, and C, actinomyces, bacteroids, and the Clostridium. All right. Now to do the culture of the obligate and arrow, what is the first thing we can do is use the Macintosh jar. ठीक है. To create the anaerobic condition, we can use what, Macintosh jar, or we can use a sterile jelly on the top. But what is the most important? It's Robertson cooked media broth. It is what, Robertson cooked media, cooked media broth. ठीक है. That is, it is having what, it is having the, it is having the beef hard particles, that is having what? That is having the glutathione in the reduced form, that is having the reduced glutathione, and it will keep the environment in the anaerobic form, and having the petroleum jelly of the top to create the environment totally obligate anaerobic for the clostridium. All right. Now, another thing we need to remember is the question that is asked that predominantly, examples of the predominantly saprophytic clostridium, predominantly saprophytic clostridium, that is, they are getting food by dissolving the organic material. And what are the examples of the predominantly saprophytic is what? Clostridium perfringens, Clostridium perfringens, Clostridium difficile, Clostridium difficile, Clostridium novi, and Clostridium septicum, All right. So predominantly saprophytic, Clostridium perfringens, Clostridium difficile, novi, and the septicum. Okay, that is PNSD. They were typically predominantly saprophytic, perfringens, novi, septicum, and the difficile. Now we'll talk one by one the important points of the other Clostridium families, subfamilies. That is first about the Clostridium perfringens, Clostridium perfringens. Okay. Now we have talked about it. The Clostridium perfringens is non-motile. Although this Clostridium is having peritragus flagella, it is motile, but Clostridium perfringens is non-motile. Another important point is that it is what? Capsulated. It is what? Capsulated. Plus the spores are what? The spores are what? Heat resistant. Although the spores of the Clostridium are killed at 100 degrees Celsius, but the spores of the Clostridium botulinum and the spores of the Clostridium perfringens are what? Heat resistance, and they are killed at 121 degrees Celsius by the autoclave. ठीक है. Another important point, they easily grow at 45 degrees Celsius. 45 degrees Celsius. Now the very important key points of the Clostridium perfringens is that they show target hemolysis. They show target hemolysis or double zone of double zone of hemolysis. Okay, so they show what the target hemolysis or the double zone of hemolysis. When we'll read about the Clostridium perfringens, we'll learn that two types of toxins are there. One is major and another is minor. Okay, in the major, alpha, beta, eta, these are the major toxins, and alpha is the most important toxin, that is lecithinase toxin. All right, so by the lecithinase toxin we see a reaction, that is what? Naglose reaction. That is what? Naglose reaction. We see the activity of the lecithinase in the media. Okay, so double zone of hemolysis, Naglose reaction. All right. And another is what? Reverse cam test. Reverse cam test. Okay, reverse cam test. So all these 3 points, that they show the target zone of hemolysis or double zone of hemolysis. They show the Naglose reaction and the reverse cam test in the Clostridium perfringens. And they show what? They show the stormy fermentation on the litmus paper. Okay, they show what? The stormy fermentation on the litmus paper. Now we'll see the picture of the Naglose reaction. And what is the most important disease? The most important disease is that they cause what? Cause the gas gangrene. Gas gangrene. Other gas gangrene causing Clostridium is what? PNS. That is what? Clostridium perfringens, Clostridium novi, and Clostridium septicum. Okay, that is, they all are causing what? Gas gangrene. They all are causing what? Gas gangrene, and typically Clostridium perfringens type A. Clostridium perfringens type A. All right. Now when we talk about the food poisoning by the Clostridium, poisoning by the Clostridium perfringens, type A is causing what the poison, and what is actually it is a type A strain, and the due to what the resistance spores, because the spores of the Clostridium perfringens are resistant and they are able to survive around 100 degrees Celsius. Okay, irrespective of the other Clostridium, because the spores are not that heat resistant, with incubation period of 8 to 48 hours. 8 to 48 hours is the, we are talking about the food poisoning. Next, very important, we have already talked about the gas gangrene. That is a type A Clostridium perfringens is responsible for causing the gas gangrene. Other than the perfringens, it is what PNS. Okay, and next is what necrotizing enteritis. Necrotizing enteritis is common, also it is also known as the pig bell disease. Pig bell disease, and the patient will present the history of consumption of the pork and the consumption of the sweet potato or the sweet potato, and it is caused by the type C strain of the Clostridium perfringens, type C. All right, please remember necrotizing enteritis is by type C. All right, and food poisoning by the type A. Now we'll see for this the points that we have discussed, that it is called, it is having what, it is having the stately motility. We have seen that sports, we have seen that O and the terminal sports are very important, resembling the tennis racket sports that is present in the tertium. In titne, it is what drumstick appearance sports. All right, and anaerobic method, Macintosh jar, Robertson cooked media, Clostridium perfringens. It is what having target hemolysis or the double zone of the hemolysis, and typical characteristic gas gangrene. Naglers reaction, will see reverse cam test is positive in that of the Clostridium perfringens. Reverse cam test will do nothing. Clostridium perfringens longitudinal streak, and perpendicular to that is the group B streptococcus. We see arrowhead beta hemolysis, increased zone of hemolysis at the point of the contact. That is arrowhead beta hemolysis we see at the point of the contact. All right. Clostridium perfringens, we have talked about the clinical features at it present mainly cause the gas gangrene, food poisoning, and the necrotizing enteritis. That is what pig bell disease by the type C Clostridium perfringens. By the type C Clostridium perfringens. Although it is a self-limiting disease and no antibiotics is given, the reason is being that once the toxin has been released by the Clostridium, the role of the antibiotics is limited in that case. Pig bell disease very important by the type C, and the diarrhea, food poisoning by the type A. All right, toxins major and the minor. It is mainly the alpha toxin which is responsible for virulence factor of the Clostridium perfringens, and it is what a lethal toxin. It is what lecithinase toxin. Nagler's reaction we discussed. On one half of the media we put down what the antitoxin, and another half it is having no alpha antitoxin. So we can see the opacification due to lecithinase activity of the alpha toxin of the Clostridium perfringens on one half of the media. Okay, now we'll talk about the, we are done with the Clostridium perfringens. Quickly we'll talk about the Clostridium tetani. Okay, Clostridium tetani. All right, now Clostridium tetani, it is what, it is also non-motile, and it is highly antigenic and strictly anaerobe. All right, and the spore are having what, drumstick appearance. That is what, terminal, and the circular spore, giving the appearance of the drumstick appearance. Two toxin, one is titanolysin and another is what, titanospasmin. Okay, titanolysin has no role in the pathogenesis, while titanospasmin, it is responsible for the virulence, and it is a toxin that is responsible for the spasmin, that is the spastic paralysis of the muscles, and it shows what, retrograde, important, it shows what, retrograde axonal transport. retrograde axonal transport. ठीक है, it shows what retrograde axonal transport and causing what the spastic paralysis. Spastic paralysis, what is the main site of action? It is what brainstem and the spinal cord, brainstem and the spinal cord. ठीक है, and it causes what presynaptically inhibition of the release of the inhibitory neurons, that is GABA and glycine. GABA and glycine. So what are the important points? Two types of toxin, that is what this titanolysin, titanospasmin. Titanolysin doesn't have any role. Titanospasmin causes spastic paralysis, and the main site of action is brainstem and the spinal cord, and it causes the presynaptic inhibition of the glycine and the GABA. अगर presynaptic incubation period is around 6 to 10 days. अगर presynaptic inhibition of the involuntary movements, involuntary this inhibitory neurons, the person will go into continuous contraction, spastic contraction of the muscles. That what is the first sign? What is the first sign of the generalized tetanus? It is what? Jaw, lock jaw or the trismus, and most common tetanus is what? Juvenile, and the most severe one is the neonatal tetanus or the eighth day disease. Neonatal tetanus or the eighth day disease. For the diagnosis, we do the toxigenicity test. ठीक है, we do the toxigenicity test in the tail of rat, and we see the erected tail in the localized tetanus and the opisthotonous position of the rat. ठीक है, so this is about the Clostridium tetanus. Clostridium tetanus, it is what causing the complications are the rhizus sardonicus, smiling face rhizus sardonicus, and the opisthotonous position of the patient, causing the drumstick appearance of the spores, and the mechanism is what? Presynaptic inhibition of the inhibitory neurons, that is the glycine and the gamma, and the patient goes into what? Spastic paralysis. From the toxin only, it is titanolysin, titanospasmin, causing the spastic paralysis. Causing what? The spastic paralysis. ठीक है, we already told you that the toxigenicity test we do in the tail of the mice, or the generalized toxin we see what in the opisthotonous position of the mice. Now next important is the Clostridium botulinum. ठीक है, Clostridium botulinum. Now it is what? It is also motile, obligate, aerobe, and having what are the it is what? Non-capsulated. Only capsulated is the Clostridium perfringens. All right. Now it releases the toxin, that is the botulinum toxin, which is what? Which is a neurotoxin. Please remember, it is a neurotoxin. All right, and it has 8 antigenic variants. Human variants are caused by the A, B, E, and F. ठीक है, so these are what? Human antigenic variants of the toxin. And G causes no disease, because till A to G are there, and G causes no disease. And C2, C1, C2 is what? Enterotoxin. Although the botulinum toxin is a neurotoxin, but C2 is an enterotoxin. G is not causing any type of disease, and human pathogens is shown by the A, B, E, and F type of antigenic variants. Now, Clostridium botulinum toxin, it is actually released as a protoxin. And act as an NMG, so at the pre and the post synaptic ganglions. What does it do? Having the binding site for the ACH, it cleaves down the binding site of the ACH. All right, that is a synaptobravin. It breaks down the binding site for the ACH. It cleaves down the syntaxin, synaptobravin, and the SNAP. It breaks down these uh, a binding site for the ACH. So it causes the blockage of the ACH. So patient will present with what? Descending flaccid paralysis. Flaccid paralysis. ठीक है. And the 5D features, that is what? Diplopia, dry mouth, dysarthria, this dilated pupil, decreased DTR, and descending flaccid paralysis. Patient will present with the D features, that is a diplopia, dry mouth, dysarthria, dilated pupil, descending symmetrical flaccid paralysis. The main point is that there is no sensory involvement. There is no sensory involvement. There is no sensory involvement and no altered mentation. There is no sensory involvement and there is no altered mentation. Very important for the treatment, we give the anti botulinum toxin, that is equine derived. For the treatment we give equine derived anti botulinum toxin. ठीक है, anti botulinum toxin. All right, and the patient will present of the clinical features, but constipation will also be one of that. Please remember, constipation and complication in the baby will be what? Floppy baby syndrome. Floppy baby syndrome by the Clostridium botulinum toxin. B4B, that is the baby syndrome. That is the Clostridium will cause the floppy baby syndrome. So we are talking about the Clostridium botulinum, that is a canned food. It is a preformed toxin in the canned food, and the incubation period is what? About 18 to 36 hour. 18 to 36 hour. And it is a biohazard. It is the most toxic compound we know till now, that is a botulism toxin. And it is a protoxin that is released and it is activated later by the proteolytic enzymes, that is a trypsin, and it causes what? The blockage of the release of the inhibition of the ACH. A, B, E, and F, they are human toxins that are responsible. G doesn't cause any disease, and C2 is an enterotoxin. Okay, C2 is what? An enterotoxin. This is the floppy baby syndrome. Floppy baby syndrome. This is what? Floppy baby syndrome, and it is caused by the Clostridium botulinum, and the patient will present with hypotonia and decreased sucking reflex. All right, so the patient will say that first 2 days it was normal, it was having the normal sucking, but after that the reflexes became uh, flaccid. Dheere dheere they become rigid and the flaccid. So what are the disease? One is the foodborne the botulism, that is a canned food. Preformed botulism is present. Spores are present, and there is an infantile botulism, that is what? Floppy baby syndrome. And the wound botulism, that is the exposed site is having the spores. Now, next important is what? Clostridium difficile. Clostridium difficile. Now, Clostridium difficile is responsible for causing the pseudomembrane colitis, and paralytical ileus. Okay, paralytical ileus, and they are having two types of toxin, that is toxin A and toxin B. Toxin A is what? Enterotoxin, and toxin B is what? Cytotoxin. Okay, two types of toxin, toxin A and toxin B. Enterotoxin and the cytotoxin, what does they do? They are normally present as a normal gut flora, and they are present in the feces of the normal person. But when the person is having a long stay in the hospital and is consuming the broad spectrum antibiotics since a long time, it alters down the normal gut flora of the gut. Therefore, the Clostridium difficile start multiplying, and it alters the mucosal barrier, and it leads to the formation of the pseudomembrane in the gut, pseudomembrane colitis, and the paralytical ileus is another complication of that. All right, so that is what having the yellow colored plaques and the membrane over the gut. So this was it for the treatment. What we do for the treatment? For the treatment, what is the drug of the choice? For the mild case, M4M metronidazole is the drug of the choice. M4M metronidazole is the drug of the choice. But if it is a severe case, then vancomycin. vancomycin with the metronidazole is the drug of the choice. ठीक है, vancomycin with the metronidazole is the drug of the choice. So this was it. I told that I'll cover the topic within half an hour, and all the important points of the Clostridium were covered just within half an hour. Other than this, that in the PDF, along with the all the pictures, the theoretical part is also being given in the PDF only. So you can go to the PDF ones that is taken from the standard books. You can also go to the PDF book as well. So thank you for today's session, and sorry for being late today because there was a power cut and there was no power supply at home, so I was unable to take the class dot at 10, and therefore I started the class late. And I do apologies for that and very sorry for that. If I wasted your precious time, I'm very, very literally sorry for that. Okay, so I'll see you in the next session. And today we'll cover on the YouTube, we'll cover the FMG, we'll cover the previously yearly asked questions, we'll cover the FMG questions and the images today at the 10 p.m. So do please come to the class at the right time, and do like, share, subscribe, and follow me on the Unacademy channel as well as the YouTube channel and Instagram on the Telegram. I will see you soon. Take care until then. Bye bye.